Oregon lawmakers are planning to introduce another bill. This one, they say, would hold ICE accountable at healthcare facilities when agents accompany detainees who are receiving health care. The Healthcare Without Fear Act is sponsored by a trio of Democrats, including State Senator Winsby Campos. Fox 12's Leslie Dominique spoke with lawmakers and the Oregon Nurses Association at a press conference about this issue today.
Sponsors of the bill say that it's designed to protect both healthcare workers and patients during interactions with federal immigration officers on medical campuses. They say it's also intended to hold federal agents to the same standards as other law enforcement.
We are here today because hospitals must never be weaponized.
State lawmakers backed by the Oregon Nurses Association announced Friday they plan to introduce Senate Bill 1570, the Healthcare Without Fear Act. The bill would put limits on immigration enforcement activity in hospitals and hold federal officers to the same standards as other law enforcement. Nurses say they've reported multiple incidents involving federal agents on medical campuses across the state. ONA claims agents have pressured staff to shorten care, refused to step away during private visits, and removed patients against medical advice. Actions they say violate HIPAA.
It really impedes our ability to provide the work. And as human beings, it hurts our hearts because we didn't go into the work to not be able to do it.
Lawmakers worry that ICE operations at hospitals may discourage undocumented immigrants from seeking care. Their concerns follow recent incidents, including the shooting of 2 Venezuelan nationals by Border Patrol agents in an Adventist clinic parking lot, and the detention of a family seeking asylum while trying to get care for their 7-year-old daughter. Under the proposed bill, Oregon hospitals would be required to designate non-public patient areas where immigration enforcement is restricted without a valid warrant or court order. A patient's immigration status and place of birth would also be classified as protected health information.
This bill puts the onus on administration, whether we're talking about hospitals or clinics.
As far as protections for healthcare workers, supervisors, not frontline staff, would be responsible for interacting with immigration officers. And the bill would prohibit retaliation against workers who share information about immigration or constitutional rights.
It is a promise that Oregon's hospitals will be a safe space, a promise that violence and intimidation have no place in healthcare settings.
Senator Campos says lawmakers expect draft language as early as Monday. We have reached out to both ICE and DHS for comment. We have not yet received a response. For now, reporting in Tualatin, Leslie Dominique, Fox 12 Oregon.